Today we're speaking with Dr. John Niederhuber, Director of the National Cancer Institute since 2006. Dr. Niederhuber has just won a Distinguished Public Service Award from the AACR. Thank you for joining us, Dr. Niederhuber.
You're most welcome.
Congratulations on winning this award. What does it mean to you to be recognized this way?
Well, as I said in my opening comment, it's kind of a wow, golly gee. But it's a tremendous honor to be recognized by one's colleagues at the AACR and to be given this award. I've really enjoyed very much being able to spend this period of time in my life in public service as the director of the National Cancer Institute. Totally unexpected opportunity for me, and I've cherished it very much, and I certainly will cherish this award, this recognition of my service.
What accomplishments are you most proud of as NCI director?
Gosh, it's hard to be specific and pick one or two. I think that we've changed some of the structure of NCI. We've been able to stop a few programs that probably needed to be phased out, and we've worked through a very difficult period of time in which the budget was quite flat without increases each year. So that meant that we had to take a significant amount of money, about $175 million a year, out of the budget, and to still try to keep momentum and growth and fund the talented scientists across the country. I think I'm proud too that we were able to do that, but we were also able to start some new programs. Programs in nanotechnology, programs in bringing physicists and mathematicians into working on oncology. People had never worked in the cancer research field before, and they've started a very, very exciting program. So there are lots of new things that we've initiated that I'm very proud of. Also proud of the Community Cancer Centers program that I got started. So a number of things.
And what has been the most significant advance so far in cancer medicine during your tenure as NCI director?
Well, we made certainly progress towards the concept of what we call highly personalized medicine, understanding that cancer is really a disease of altered genes, and therefore the effects of those altered genes on the cancer cell itself and on the signaling pathways, the way the cells communicate, both among themselves and with the host cells. So I'm pleased with the fact that our knowledge has increased. We've certainly had new drugs become available as a result of that work in highly personalized medicine. We've initiated a pilot, a very successful pilot, called the TCGA program, in which we've been characterizing patients' tumors and sequencing, doing deep sequencing of those tumors. So a technology around that has advanced and been pushed, I think, because we've invested in that program. The pilot has been very successful, and now we're going to move on into trying to do all of cancer in terms of understanding its genetic basis. And I think this is going to be tremendously transforming and powerful for scientists and for eventually for prevention and development of new therapies for cancer. We've also made advances in prevention of cancer. The approval of the human papillomavirus vaccine in terms of being able to prevent cervical cancer. If you think about that globally, that's a tremendous advance forward, and that work has really been primarily done at the National Cancer Institute in our intramural program, so I'm especially proud of that.
What are the new frontiers of cancer research that young investigators should consider working in?
Well, the real new program, or frontier, I guess you would call it, is I think what I was really just talking about a moment ago in terms of of technology and how the technology of sequencing is really empowering us to really understand all of the genetic defects that lead to the initiation of this disease and the progression of this disease. So clearly the immense amount of data that will be generated by by that technology and by the fact that the cost of doing that is dramatically decreasing. So within the next decade, for scientists and for actually physicians caring for patients, we will think nothing of being able to do a patient's complete sequence. We'll do it for less than $1,000, and we'll do it within hours and not days or weeks. So that's tremendous change if you think about it, and it's obviously going to have a huge impact on the diagnosis and care of cancer, but all diseases. And cancer, I think, is leading the way in many ways of how we will approach all diseases, not just cancer. So this powerful technology and powerful tool is going to really inform the scientists working in the laboratory, but also eventually our patients and our caregivers as they design the treatment for the patient sitting before them. We have a long ways to go to get that kind of information and analyzable, if you will, and deliverable at the point of care for the patient. But we'll get there. There's no question that we will. So that's, to me, that's the tremendously exciting frontier for our young people that are not only entering in laboratory research, but entering in as clinicians with interest in science as well. We call them our translational scientists, our clinical caregivers that are also on the frontier of science as well.
Last question. What, in your opinion, is needed to stem the tide of this disease?
Well, you know, I've often been asked that, and it's a very difficult question to just answer simply. We really have to know an awful lot more about the disease and about the biology of the disease and how the disease starts within the host and how the host and the disease interact. My own laboratory, we work a lot on what we call the microenvironment, which is really the host tissue, which just looks quite normal under the microscope, but is completely reprogrammed genetically to support this this process of cancer development and cancer progression. So we need to understand that. We need to make progress in being able to develop the ways to control that process from the host side as well. So I think lots to do. It's a very, very complex disease, and it's. I don't think that as we age, and we're all aging, the fastest part of growing part of our population is that over the age of 70, 75. And cancer predominantly occurs in the older population. So there's an element of cancer that is just going to occur because of that process, and because as humans we are created to survive evolutionarily, adjust to our environment and survive. But part of the price for that is that we can develop cancers along the way. So,
thank you so much for joining us.
You're welcome. It's been a pleasure. Thank you.